What's up? Alright, so Nick here with your 3-month post-op video, double incision with Dr. Medalie in Cleveland, Ohio. Everything's going very well. I'm still moisturizing my chest 2 to 3 times a day, pretty much 2 times a day just because it's hard to get in to moisturize it 3 times a day when I'm working. So anyway, also, because of the work I do, I have continued to wear my compression vest just to help with the swelling and stuff that happens while I'm working. I'm lifting stuff overhead and it's pretty heavy and takes a toll. So everything helps. Yeah, so let's see. My left nipple is still tender and scabbed over. My right one, the scab's completely gone. It's super nice. I can do whatever I want to this side. This side, don't even want to touch it. Just leaving it alone. Letting it heal, keeping it moisturized. Still wearing like the pads over my nipples when I'm wearing the compression vest just to help with the irritation or anything like that. Let's see. I think around the 3.5, maybe 4-month mark, I won't be wearing the compression vest anymore because things seem to be tightening up pretty well and gaining a little more elasticity within the incisions. I don't know. We'll see. But yeah, let's see. Still get misgendered just because, and I don't care. I don't care as much anymore, actually. That's something I've come to realize, is that because I am so more, I accept me and myself and my body more, I don't care about what anybody's looking at, thinking about, or anything like that. Pronouns kind of bug me here and there if you know, if somebody knows me and they do it, but if they don't know me and they misgender me or anything like that, I really don't care. Because I'm happy and content and just I have other things to think about. Not worry or stress, but things to think about. So yeah, my confidence has gone up once again. Life is great. It's about to be 2 months next week that I've been on testosterone. That has been wonderful. I'm still doing my yoga every day. I am only doing lower body yoga still just because it hurts when I do like a downward dog or a chaturanga or anything like that, and then all that weight is being dispersed up top and it just puts a lot of strain on my incisions. So I haven't been doing that. When I go to the gym, I do lift my arms and I have been doing like some shoulder press stuff, but nothing with the chest. I'm trying to avoid the chest as much as possible just because the incisions are super fresh. So I'm trying to avoid stretching as much as possible, but I also am not trying to be like a couch potato or anything like that. So, yeah, doing that, feels really good to get back in the gym, especially with being on testosterone. Like just the results from what I do happen to appear much more quickly versus when I wasn't on testosterone. With that said as well, I'll be on testosterone for maybe another month or 2. I think I'm gonna drop my dose and start taking a shot every other week. Yeah, I like being on testosterone, but there's just times where I don't feel okay. Like I feel like something's a little off, and it's not with my mental or anything like that. It's just completely with my body. It's my physical body. Also, testosterone hasn't done anything to my mentality. Nothing. It's made me happier, more content and stuff like that just because I feel more comfortable, but testosterone hasn't made me happy and more content. Nor has it made me more aggressive or irritable, like none of that. If anything, I would say that going through PMS made me more irritable and aggressive. But then again, I am built different from the next person that's standing next to me doing the same thing with their body. You know, who knows? Maybe testosterone is wreaking havoc on them and having PMS is the best time of their life. I don't know. But for me, I would rather be on testosterone any day than deal with being on PMS and being a crabby, weird person that I don't know. So, yeah, testosterone's great. My libido has jumped a smidge, but it's nothing out of the ordinary. It's what I've been dealing with. And yeah, I have noticed an increase in energy, but I wouldn't necessarily say it's energy. I'd say that it's just the fact that I have more muscle, so I can do more things than before. I don't know if that makes sense, but it does to me because I have the same amount of energy. It's just things are easier because I have more strength to do them. So I don't know if that's whatever. There it is. And my voice is dropping. It's awesome. I have some people that like to say that they can't hear the change in my voice or that they can't see the change in my face, but I definitely can see the change in my face and I can hear the difference in my voice. It's all amazing. My face has gotten wider. It's kind of weird. Sometimes I don't really care for it, but it'll come around. And I'll be going back to what I looked like anyway, eventually, kind of. So yeah, that's my little boring video. 3 months post-op, Dr. Medalie, Cleveland, Ohio. Best decision of my life. I'm happy. And winter's here. Enjoying the snow, kind of. Last winter in Minnesota, yay. So yeah, alright guys. You saw me doing the thing with the chest. Let's see, flex a little bit. No, kind of hurts. Kind of like, maybe I need to moisturize real quick. Alright, have a good day, everybody. Happy Halloween, by the way, and I will see you on my birthday. Yeah. See you December 1st. Later!